Hi, my name is Hermes Finney Sital, and today we're going to talk about motivational interviewing. Motivational interviewing is a person-centered, collaborative technique used with clients with mental health, substance abuse, and other chronic disorders to change a negative behavior to help them live a healthy lifestyle. Motivational interviewing builds on Carl Rogers' humanistic approach that believes that people have free will. Motivational interviewing believes that people have the tools and techniques to change, and the social worker is there to kind of help them identify them. The primary goal of motivational interviewing is to get the client to identify ambivalence. In other words, where's the conflict? The conflict of what they're saying and what they're actually doing. Motivational interviewing is a very short-term approach. The goal is to get the client motivated and begin to work on change. When dealing with the social worker's role in motivational interviewing, there needs to be a strong therapeutic relationship between the social worker and the client. In motivational interviewing, there are things that the social worker, behaviors that the social worker should possess and things that they shouldn't do. Some of the do's. The social worker should be an active listener. It's important for them to hear everything the client is saying to help them identify conflicts between the goal of the goal of the client and their behaviors. A client in social worker should also be very empathetic in motivational interviewing. They don't want the client to feel pressured. They want them to be able to open up and so that they can truly identify the tools that they possess. Motivational interviewing, the social worker should promote self-efficacy. Example of that, it seems like you're really trying hard to stop drinking if we're talking about an alcoholic. Another thing is a social worker should be able to roll with resistance. When dealing with motivational interviewing, there will be some conflict in of what the client is saying and what they're doing, but we don't want to confront the client. We kind of want to roll with it so that we can help the client identify the conflict themselves. Also, in motivational interviewing, it's important for the social worker to be culturally competent so that they can identify different resources that the client may utilize to address the issues, such as religious beliefs, various ideologies, and such. Social workers things that the social worker should not do in motivation interviewing. There should be no arguments. You don't want to argue with the client. Again, we're looking to motivate the client, and we do want a strong alliance between the social worker and the client, and argument definitely pulls away from the therapeutic alliance. We don't want to do any sort of direct confrontation. Yes, we do want to identify the conflicts between what the client is saying and what they're doing, but we don't, as a social worker, don't want to be the one to identify that. We want to help the client see it themselves. So again, that they can see that they possess the tools and techniques to change those behaviors. We don't want to try to persuade the client to do anything. Again, focusing on this is the client possesses the tools and techniques to change the negative behaviors. So we want it to be the client's thoughts and ability that makes the change and not the social workers. And we definitely don't want to put any labels on the behaviors. We're focusing on the client. When doing an assessment for motivational interviewing, one of the techniques definitely is asking open-ended questions. Open-ended questions can vary. Something like, what brings you in today? Tell me about your life and how alcohol has affected your life. You also want to use evocative questions about ambivalence, change, and motivation. So, again, what makes you want to stop drinking? what are some of the negative aspects of drinking. You can use scaling questions to determine your motivation. On a scale from 1 to 10, how motivated are you to change, to work towards to stop drinking? And of course, the key is definitely, once again, listening. You really need to be an active listener when motivational interviewing, because you want to identify what stage of change the client may be in. And the stages of change, there are 6 stages of change. There's pre-contemplation stage. This is where the client knows they're alcoholic, but they may not see any negativity in it, and they're not ready to change the behavior. The contemplation stage is where the client has identified that they're an alcoholic, and they can identify some negativity of their behavior, but they're maybe not ready to make that change at this time. Then you have the preparation stage. This is where the client is, I know I'm an alcoholic, I have this bad behavior, and I'm ready to make this change, and I'm planning out how I'm going to make this change. Instead of taking a drink in the morning, I'm going to go for a walk, or I'm going to count to 10. But they're setting out their plan of action to make that change. Then you have the action stage, and that is where the client is actually following through on their plans. So they're doing what they set out to do to achieve the goal of getting rid of the negative behavior. Then you have the maintenance stage. Again, we're using an example of an alcoholic. In the maintenance stage, they've stopped drinking, and they're using all the tools and techniques that they have identified to maintain sobriety. And the final stage is relapse. While relapse doesn't always have to be a part of the process, it does happen, and that's where the person kind of slips back into the old negative behavior, and it may be consistent, or it may just be a one-time and they're able to pull themselves back on track. Meaning, if, and again, an alcoholic was sober for 6 months and then something went wrong and they turned to alcohol for that day. But again, it doesn't mean that they have to fall back into the alcoholism. They could possibly drink that day and then get right back on go back to the tools and techniques they've used previously. When you think of intervention for social motivational interviewing with a client, you want to start with meeting the client where they're at. If they're not ready to stop drinking or change whatever negative behavior there is, don't apply the pressure. Just, again, relate what the client is saying back to them using some of the other questioning techniques that we will further discuss. Explore issues and accept the client's perception. The client says there's nothing wrong with alcohol. It's not causing any negative effects on their life. Roll with it, okay? Keep going, explore more. Hopefully the client will say something else that conflicts with their first perception. So if they may say, alcohol has no negative effects on me. But then as you keep going and exploring, asking different questions, the client may then say, well, when I drink alcohol, I get aggressive. So again, that whole listening and exploring the client's perception of things. We definitely want to reinforce change comments. I'm thinking, if the client is like, I'm thinking I maybe should stop drinking, you want to say, well, maybe that would be a good thing. What would be some of the benefits if you stop drinking? You want to get them to, again, get the client motivated to see the negativity of the behavior so that they can move for change. And of course, affirm the client's ability to change. The client said, I'm not sure, I think I can do this. Maybe I can. You let them, as a social worker, you can let them know, I think that you can. I've listened to your story. You've shown me that you're determined, you're committed. I think that this is something that you can do. Okay, then you have the types of intervention questions used for motivational interviewing. Change talk. The goal of change talk is to get the client to see the issue and start thinking of ideas to work towards changing the issue. For example, What would you like to see different? That could be a question. Another question could be, why do you feel you need to change? Again, you want to get the client involved and help them identify that they possess the tools. Importance and confidence. You definitely want to ask the question, how important is it for you to stop drinking? What would be different if you stop drinking? You can use a scaling question. On a scale of 1 to 10, how motivated are you to stop drinking? Again, open-ended questions. What brings you here today? What happens when you drink? And then you have what is known as the Columbo approach. The Columbo approach is, again, it's like a balancing tool. You can get them to see, again, the conflict. You can say something like, on one hand, you say that alcohol has no effect on you. But on the other hand, you say that you experience blackouts when you drink alcohol. Again, you want to get the client to see the conflicts, that help them identify the ambivalence of their behaviors. Additional techniques can be used as normalizing. You can help the client, not feel so tense by it. A lot of people are concerned about drinking, or I know many people who have gone through the same situation and expressed the same concerns. Decision balancing. So what would be the benefits if you stop drinking? What would be the cons if you stop drinking? You want to try to get them to see that the benefits of changing the behavior outweigh the benefits of continuing to do the negative behavior. You want to, again, assess their readiness to change using, again, active listening and going through the change steps and seeing where they're at. You want to do affirmations. Your commitment shows that you're dedicated to stop drinking, firm their behaviors. You want to give advice and feedback, educate them. You might say, study shows that 90% of alcoholics develop cirrhosis of the liver. And again, summarizing. Summarizing is key. It shows that you're listening. You're reflecting back to the client what they said, and hopefully they get to identify their own conflicts in their behavior. I want to thank you very much for listening to my presentation. And now what we're going to do is actually see a session between the client and the counselor and see how you actually utilize the tools of motivational interviewing. Thank you.